Welcome. Thank you very much for joining. We called this press conference because we were concerned about the reopening of the province and the potential for March break with a lot of travel and the spread of the UK variant of COVID-19, which is now in the north as well as in Southern Ontario, and which is spreading actually very quickly.
Yeah.
I'm sorry, would the media folks mind just muting your lines? Okay, thank you. Sorry, I have a hair in my mouth. Okay, there we go. And so we wanted to talk with you a little bit about the concerns about this debate about the northern bubble and you know, things that we think the public really needs to understand moving forward as the province is opening up and as there is a potential for either March break or maybe not a March break. And we understand that that should be clarified in this afternoon's provincial press conference by the Ontario government. So we've been tracking the cases of the UK variant as they're spreading across the province with some concern, you know, starting from January 25th, when we only had about 38 confirmed cases. At this point, we now have, as of yesterday, 227 confirmed cases of the UK variant. And from our tracking, we see that there are another between 200 and 300 variant cases that are being identified, that are being investigated, or cases that are attached to outbreaks where the variant has been identified. And so there's a much higher likelihood that they are the UK variant. There is no question now that the UK variant is much more contagious. In Britain, it was traced back to September the 20th. The first cases by the week of December the 10th, 68% of the cases in the UK were of the UK variant. It took over, it swept through southeastern England, across through London, and across the south very, very quickly, and ended up with the hospitals being swamped and patients being sent up to way in the north of England to be able to access critical care and hospital care and so on. Yesterday, Eileen Davila, the Chief Medical Officer of Health for Toronto, I think very rightfully and sensibly warned people that we are transitioning from one pandemic into another pandemic. And the pandemic of the new variant could be quite different and much faster moving than the first, than what we've experienced to date. And so we wanted to bring a warning. Obviously, we have seen now across the north cases of COVID-19, but largely in the north, they have been controlled. And, you know, the first wave was not to minimize anyone's suffering or anyone's death, but it was very small in Northern Ontario. The second wave has been worse, for sure. Many of the cases associated with travel, either people traveling out of and back into Northern Ontario or people traveling into Northern Ontario. And the same thing happened over Christmas or the Hanukkah, Christmas, winter break, where cases spread from people traveling. And so going forward, I think we want to make sure that communities understand the risk of travel at this point, which is higher than it was before and can result in really devastating consequences. Just since December 31st alone, almost 1,000 residents and staff in long-term care homes in Ontario have died just since December 31st. That is from the increase in cases leading in the Christmas shopping and visiting and the holiday break visiting and so on. And now we're seeing really very worrisome spread of the UK variant in North Bay, in the apartment outbreak, in Barrie, in the Roberta Place outbreak, in North York, in the meatpacking plant outbreak. And we released a press release this morning tracking those cases, but there are now very significant numbers and growing very, very quickly. And so we called this press conference to ask people, you know, the Ford government has not announced any new public health measures to stem the tide of the potential tide of this new, much more contagious variant, which also now is associated with higher death rates and certainly has moved extraordinarily quickly in Roberta Place, where more than half of the residents have died in an outbreak that is just 1 month old. That is unusual, even in the large outbreaks in Ontario. It's horrifying. And so we're calling on the public to really understand what's happening, what the threats are, and to really curtail travel, curtail unnecessary travel, and try and protect Northern Ontario in the way that it was protected in the first wave. So I'm just going to turn it over first to Ben Lefebvre, who is in Iroquois Falls. Go ahead, Ben.
Hi, thanks, Natalie. Okay, in Iroquois Falls here, we're part of the large, very large Porcupine Health Unit. I'm not sure how many square kilometers it encompasses, but I think it runs somewhere from Hornpain to Kirkland Lake through Timmins. We're about 3/4 of an hour outside of Timmins. And so far, we've been very lucky. We've only contracted roughly 300 cases of COVID. There are only 42 that are active as we speak. And as of Monday, this day before yesterday, there were only 22 deaths in the entire region. So far, we're doing really, really well. Unfortunately, one of the long-term care homes in our unit up in Kapuskasing, Extended Care, as it turns out, which of course is privately owned and privately operated, has had a pretty major outbreak and a number of deaths. I think there's 11 deaths there so far that have been identified as COVID related. One of which possibly looks like, and I think has been confirmed, is the UK variant. So it is scary. And as Natalie suggested, chances are it probably is a result of travel over Christmas, et cetera. So we simply can't afford to have people coming up from Southern Ontario. And of course, we have the same issue with people from the north visiting family down south and then possibly bringing it back. Right now, so far in Iroquois Falls, knock on wood, we've been good. We haven't had any cases here locally. There were a couple of scares some time back, but nothing positive that came out of them. We want to protect ourselves, and I think it's only fair that the Northern Ontario should have that kind of protection, I suppose. And the only way that we're going to get that is by requesting the respect from other people that are going to travel or planning on traveling to hopefully just stay home, particularly over the upcoming March break, if it does occur. So that's all I need to say at this point in time.
Thank you, Ben.
Pass it on.
Okay, thanks, Ben. So Ben Lefebvre is the Ontario Health Coalition spokesperson for Northeastern Ontario. For your information, that case in the Cochrane district, that's the Porcupine Health Unit, it's at Extended Care Kapuskasing. By the latest data, February 4th, that we have, 68 people had been infected in that outbreak. 11, sadly, awfully, have died. And there is one case, one person associated with that outbreak who they have now confirmed as having the UK variant. And so that's why that is an outbreak of concern. Okay, so I'll now ask Marie Delavedova, who is the spokesperson for the Algoma Health Coalition. Thanks, Marie.
Thank you. I think it's a good time to point out something that I heard. The virus doesn't move, people move it. So what follows then is that if we stop moving, the virus stops moving. So we've been told to stay home as much as possible and not engage in unnecessary travel. And most of us have been doing that. But I know it's been a really long year, and we really yearn to live our lives the way we have in the past. But it's not a good enough reason to let our guard down now. People's lives hang in the balance. In Northern Ontario, our COVID-19 case numbers were low for very many months. And I'm proud to say that in the Algoma district, we were able to keep our case count extremely low. We had very few cases until shortly before Christmas, which is when our numbers spiked. And the numbers have not consistently gone back to those lower levels since. We know that there was increased travel due to the holiday season. We know that there have been cases of COVID-19 linked to travel, people traveling into our community and having close contact with others, as well as people traveling out and back in. And we know that gatherings beyond those in our immediate household can lead to exposure and spread. In January, in the midst of our second lockdown, The Algoma Public Health Unit warned of the high risk of exposure to those who had attended a specific New Year's Eve party that was actually in the news. And anyone who had attended that party was urged to self-isolate immediately. I don't know how many cases of COVID developed out of that, but I'm sure there were a number. Today, there are 21 active cases in the Algoma Public Health District, with 2 hospitalizations and an outbreak in a long-term care home. Our weekly case count has gone down significantly since the last week of January, but we are not yet back in that green zone where we were in the weeks before Christmas. To date, there have been 187 cases and tragically 2 deaths attributed to COVID-19 in the Algoma district. And now we know that variants of COVID-19 have made their way through Northern Ontario, due, of course, to people traveling. The variants are highly contagious, and while there have been no known cases of COVID-19 variants in the Algoma Public Health area, we know that those variants are on our doorstep. Once these variants are here, it would not take long for our case numbers to shoot up. I heard Dr. Teresa Tam speaking this morning, and she warned that a resurgence in COVID-19 cases due to variants will be much, much more difficult to control. So in order to keep our case numbers low and to lower them further, we have to follow public health guidelines. March break is particularly worrisome if it results in travel into and out of our area. Just one visit with family and friends can have devastating impacts on local residents, including our most vulnerable in long-term care and retirement homes. The highly infectious COVID-19 variants that are now spreading throughout the province make travel even more risky. And very often a person who has COVID-19 may not be experiencing any symptoms. They think they are safe. They have no idea that they're spreading the virus. But we know that nobody wants to bring a deadly virus into the homes of their family and friends. So we all have to be careful, consider the consequences, and persevere in following public health guidelines. Those people who do not need to travel north should not do it. Those of us in the north who do not need to travel out of our area and back in should not. Those who must travel for medical reasons or other essential travel are advised to be extremely cautious. And here, especially in Sault Ste. Marie, we know that restricting travel works in containing the virus. There's a much lower rate of infection in the Algoma district compared to the very extremely high numbers of cases just south of us in Chippewa County, Michigan. And restricting the international bridge travel to only that considered essential has undoubtedly had a role in limiting that spread. So we all want to protect our communities from the devastating toll of COVID-19. And we do not want a third wave, and we do not want a third lockdown. We have a shared responsibility to keep one another safe, especially the most vulnerable among us. So we should remember the virus doesn't move, people move it, and act accordingly.
Thank you very much, Marie.
Thanks.
Okay, now I'm going to turn it over to Jules. Jules is the Thunder Bay Health Coalition co-chair. Thanks, Jules.
Natalie. Yes, good day. I just want to talk about, just sort of build on what Ben and Maria said, is that, you know, we're very concerned about the travel and about people moving around in Thunder Bay District. We've had 1,083 cases in Thunder Bay. Obviously, we have a larger community than Algoma, and but still, we've had 27 people have died. 24 in one single long-term care home, and that's very troublesome. We found out that most of the cases, or a lot of the cases, when the second wave came, were the result of people going to Winnipeg for a pickleball tournament, and when they came back, they had some problems. They started to spread the COVID-19, and that's very concerning. So we here in Thunder Bay are always concerned about people moving around. Myself and my family, we do not move around. We encourage people not to move around. It's a very difficult situation. We phoned our friends, and everybody's getting a little crazy hanging around the house. But it's very important, as Marie and Ben have said, staying at home, not traveling around, and not meeting people, not going to different communities is so important to try and stop this COVID-19. And it's really important. There's lots of evidence out there that people that travel from community to community are spreading it, and it's very important that people don't do that. And we've been lucky, and we don't have any UK variant here in Thunder Bay yet. Knock on wood, but you never know. So we're certainly encouraging people not to travel. And again, travel by road to Thunder Bay is a long drive from Southern Ontario, but there's people, the flights are still coming in from Southern Ontario, and we certainly encourage people, if you don't have to fly to Toronto for whatever, then don't. And we're certainly encouraging people from Southern Ontario, uh, don't don't come up here. We're doing fairly well in Northern Ontario, and we want to keep it that way. So we encourage people to stay home, not to travel to the northern districts.
Thank you. And also people not to travel to Manitoba and back at this point if they can help it. Yeah. Okay, thank you very much, Jules. And now we'll be quick here. We're almost done. I'm going to introduce you to Al Dupuis. Al Dupuis is our local spokesperson, and he's in Blind River. Al, you're on mute. There you go.
There we go. Thanks very much. Add a bit to what in the Sue Marie had very eloquently pointed out just a few minutes ago. The evidence is very strong that, you know, when an area is isolated geographically or by public health measures, there's a marked difference in the rates of infection. And I think that's one of the reasons why we're on today, is to reinforce the public health measures and how they have. We know that some folks in the community can see these maybe with a bit of skepticism, even given the inconsistency in public policy that's been coming from the provincial government. In many respects, people say, well, maybe I don't need to take this seriously. We see ministers are saying one thing and they're doing another, they're traveling. Some of the public health measures earlier on were inconsistent in the sense that one big area in a city was locked down, and across the street you could walk across and do your shopping there. So I think it's normal that some folks might see some of these measures with a bit of skepticism and think, well, you know, they're not seriously, so why should I? But I think the science, the folks that have been following this as closely as Natalie in Toronto with the Health Coalition and all of the numbers we've been able to crunch, we know that the science around public health measures is sound, and we really need to support those public health measures, even if we see reasons for skepticism from some of our public officials not stepping up as they should. In Blind River, we're in central and east Algoma, about an hour and a half's drive east of Sault Ste. Marie. We've been fortunate to not have any cases here until very recently, and these were related to travel outside the region. And as a result, for example, the North Shore Health Network recently shut down to all visitors, and that includes a long-term care facility. As acting with an abundance of caution, there were no cases there. I checked with them yesterday. We have a family member who's a resident there. We really need to hang on to this for another short while, especially given the UK variants. We need to support each other in the community. Blind River has been, you know, the businesses here that were open earlier on, and even those that remain open, have been super diligent with minding public health measures, with encouraging hand sanitizing limits. They've been working really hard to keep this out of the community, and the folks are really great at doing that. So we need to keep it up for another short while, at least until I know the residents in the long-term care facility first received their Moderna vaccine just earlier this week. We'll be able to protect them very soon. And that's our most vulnerable population here. So we need to step up to the plate going for another while until we get this thing behind us.
Thanks, Al. And that's the first dose, right? The first dose of the vaccine.
That's right.
Okay,
Yeah.
so they need the second. Okay, thank you very much. And then finally, Dot, just quickly, Dot is the co-chair, and her other co-chair, Melissa, is also here, but Dot is going to speak, and she's the co-chair of the Sudbury Health Coalition. Go ahead, Dot.
Yes, the Sudbury region goes from French River including Manitoulin Island. And so we are really the entry into to Northern Ontario. And we have just learned as well that North Bay and the Nipissing Parry Sound region has the deviant, the B117, and they have COVID-19 involved there. We also know that we're very close to Peel, which has a large number of both the B117 as well as COVID. North York. We're only about a 3 to 4 hour drive from North York, and we're only 100 kilometers away from North Bay. And North Bay does have the that region does have the area that covers that you can cross from Quebec there at Mattawa. So we are really concerned. We do have 2 cases in Sudbury with the B117. And we have, in the first wave, we only had 2 deaths. And one was from international travel. And the other one was in a long-term care facility without, and we didn't really know where she got it because she wasn't leaving. In this second wave, we've had a major outbreak in a retirement home. And we have had 7 to 8 deaths in there, and staff infected. We do still have outbreaks in our long-term care facilities in Sudbury. So my concern and the North concern is stay in your own region. We realize, and I have even told my own children, I have 3 grandchildren in Ottawa, don't come up and to see me in the March break. And I have 2 in Toronto, and I told them as well, and they love to come up and play in the snow because they don't have snow in Toronto. And so we're all making a lot of concessions to this, and it's really important just to hang in some more. We will get through this, and we will really come through it much more unified. And so just as Marie in the Sioux said, it's important that we just stay the course for a little while longer, and we will get through it. We'll get through the March break staying. I sent the parcels off by mail to my grandchildren. Thanks.
Thank you very much, Todd. Thank you. Okay, thanks everybody. So just to wrap up, the decisions that people make now could prove fatal. They have already. The Christmas and holiday, Hanukkah and winter holiday traveling decisions that people have made have resulted in the spread of COVID-19 in communities that has resulted in death. People need to understand that while long-term care homes are responsible for improving their public health measures, their infection control measures to stop the spread within the homes, the fact is that high community spread of COVID-19 has resulted in more outbreaks and more potential for outbreaks that get out of control. Nowhere in the North have we seen it as horribly as in Thunder Bay, where cases attached to travel ended up spreading and resulting in just a horrible level of death and suffering. People can make choices now that will result either in protecting their communities or not. The message that is given to Ontarians by opening up, we feel is very confusing to people. So we wanted to counter with a very clear public interest message that just because the provincial government has announced the reopening of the province does not mean that the public should start to travel freely and potentially spread. And in fact, we're in more danger now than we have been because of the spread of the UK variant. And people need to really understand the extent to which it's spreading. There is a potential to protect entire regions if people do not travel into and out of them at this point. And we hope to be able to try and help make that happen. And I just wanted to end by saying there is hope here. You know, the vaccine is rolling out. In the next few weeks, we are going to receive hundreds of thousands of doses of the vaccine, and hopefully our provincial government can get its act together and move it out very quickly. But sometimes it's darkest before the dawn, and I think that's where our province sits right now. There is a potential for a second pandemic now of the UK variant in this province. It's very serious. The government, unfortunately, has not announced any new public health measures that would add a level of protection against the spread of that variant. And the message about opening up is a very dangerous one. And so we wanted to bring a very strong message today that people please think about what you're doing. These decisions are life and death decisions. Thank you. Are there any questions? Okay, Ezra from, is it Radio Canada?
Exactement, oui, French CBC.
Okay,
Voilà.
merci. Ben, can you take this one? You're on mute, my friend. Okay, please, Ezra, go ahead. Thank you.
Parfait. Bon, Monsieur Lefebvre, en fait, le message est assez uniforme, presque à l'unisson. Est-ce que vous pourriez, s'il vous plaît, juste refaire un petit peu, redonner le message, l'intention de votre rencontre aujourd'hui pour nos auditeurs en français, s'il vous plaît?
Bon, je vais essayer de mon mieux.
Merci.
Dans le Nord, on veut se protéger du virus. Les chiffres, les numéros d'affectation ici dans le Nord sont pas mal bas. Mais, par exemple, moi, je vis à Iroquois Falls, à peu près 3/4 d'heure de Timmins. Puis, notre unité, le Porcupine Health Unit, qu'on appelle ça en anglais, la région de santé dans notre région, est pas mal grand. Mais juste à ce point-ci, on a seulement 300 cas de COVID identifiés durant presque un an. Là. On a seulement 42 cas actifs à ce moment. Mais aujourd'hui, mercredi, lundi, les chiffres de morts, le numéro de morts dans notre région, on est rendu à 22. Ces numéros-là sont pas mal bas, mais le fait, parce qu'on est assez loin des grandes villes dans le sud, puis comme j'ai dit pour commencer, on veut se protéger, puis on veut que le monde reconnaisse le fait que de la part de notre distance de les grandes villes, on n'a pas besoin d'autres personnes de voyager ces jours-ci pour soit apporter le virus ici ou que nous autres, on descend dans le sud visiter nos enfants et notre parenté, puis rapporter le virus dans le nord. Alors, essentiellement, on demande à tout le monde d'être conscient de ça, puis qu'on n'est pas tellement loin de finir l'affaire du COVID. Si on peut attendre puis se protéger pour un peu plus longtemps avec les vaccins qui s'en viennent, on voit un petit peu de lumière à la fin du tunnel, comme on dit, mais alors on veut se protéger un peu plus. Aussi, j'avais mentionné en anglais plutôt avant qu'à Kapuskasing, qui est à peu près centaines de milles d'ici, il y a une facilité une maison de vieux, ça s'appelle Extended Care. Puis Extended Care, lui, il y a déjà 11 morts identifiés du virus. Puis ça, c'est une demi du total qu'on a dans la région. Alors, c'est vraiment important que le monde pense à ça, pense à nos anciens et de faire ce qu'on peut pour les protéger.
Est-ce que votre Est-ce que votre organisation supporte l'idée du maire Bigger d'ériger des points de contrôle sur la route 69 pour faire de la sensibilisation sur les voyages non essentiels?
La sensibilisation, ça serait très bien, mais je pense qu'on peut passer le message. Je ne sais pas, ça serait pas mal difficile d'arrêter les voyageurs. La grande route qui passe à travers de chez nous, c'est le transfert canadien. Alors, je ne sais pas comment ça irait pour essayer d'arrêter ça, mais je pense que si le message peut se répandre, disons, avec les dirigeants municipaux, que ça serait un bon commencement, disons. Fait que c'est certain qu'on en a parlé d'un effet et comment est-ce qu'on pourrait gérer ça, d'arrêter le trafic et les voyageurs dans le Nord, mais c'est pas mal difficile. Je pense que si on peut lui dire à tout le monde que c'est important qu'on ne voyage pas, ce serait peut-être mieux de même.
Merci.
The other thing, oh, sorry. Go ahead, Ezra.
Non.
Just saying so, merci.
Oh, merci. I can't do this in French, I apologize. But the other thing I think to note, like in addition to just the idea of stopping traffic or what have you on the 69 or the 469, I think, looking at what Prince Edward County has done, where businesses like the boutique hotels and the various landing places for people to come and do sort of recreational and tourist travel have just not opened to do that, not open for anyone from outside of the region. Businesses in some areas, I think in Espanola, we're not letting people in from outside the region and so on. I mean, there are other ways as well to, make it not attractive for people if there is a March break or as spring travel starts to increase, make it not attractive for people to come up. But some of you may want to, may have other questions about the kind of idea of a northern bubble. I know that the medical officer of health for Prince Edward County, has taken measures to extend the shutdown there under a Section 22 order. And, other chief medical officers of health are taking their own measures locally as well. Okay, I won't interject too much. Corey from the Thunder Bay News has a question for Jules.
Hi, Jules. Actually, Natalie partially led into what I was going to be asking about. We didn't get too far into the talks about an actual northern bubble. Is that something that the health coalitions are recommending? And what would that look like if that's something that you guys are in favor of?
Sorry, did you want Jules?
Yes.
Go ahead, Jules.
Well, we've had a discussion. Obviously, the northern people, those you see on the screen, have had the discussion because we know that there are some people that are wanting to have a bubble put in place. We just think that that's a difficult situation to police. There's some major highways going into the north, and we think that we're better off just basically avoiding the bubble at this point. We'll just see what happens with, of course, with the UK variant. But at this point, I think we're happy just to continue what we're saying today is to just ask people and make sure that they understand that they should stay at home. They should not travel unless it's absolutely necessary, because there are people that have to travel back and forth. There are health situations, and so that has to happen. But we're just basically at this point, and we don't know what's going to happen in the future. But at this point, we're just saying we're not looking for a bubble, but that possibly could be happening. But we're just encouraging people not to travel to the northern district of the province.
And so obviously we haven't had the variant here in Thunder Bay, but we have certainly had quite a few cases. When it comes to the variant being in some of those eastern northern Ontario health units, what's the worry level that it's getting closer, that it's eking closer to Thunder Bay?
Well, there's always that worry, Corey. But again, if people are following the guidelines that basically every health unit is providing, the ministry is providing guidelines on this. our own health unit in Thunder Bay. Clearly, Janet DeMille is basically asking people, do not travel, do not go anywhere outside of your home area, and limit travel even within your own community. So we're hoping that that is going to be enough to control the variant and to keep it out of our Thunder Bay district.
And Jules, you were worried about flights into and out of Manitoba, as that in the Northwest, the travel patterns being more towards Winnipeg, et cetera, right?
Right. Yeah.
And so
Yeah,
as the UK variant spreads in the other provinces, it's now being found in multiple provinces, that becomes more of a concern for the Northwest.
Absolutely, yeah. Where like there's some control of the I think of the movement from Manitoba. I know Manitoba doesn't want Ontario going there, and vice versa. So there's some control there, but we haven't heard of the variant in the Northwest Health Unit neither. So so hopefully people are abiding what the recommendations are.
Did you have a follow-up, Corey?
That's good. Thanks, Jules.
Okay.
Thank you. Okay, and then Elaine from the Sioux Star.
Hi there. I think part of my questions have been answered with regards to the bubble situation, but I'm just kind of wondering if your organization is doing anything to follow up with the public health units regarding the vaccine and its eventual plan for distribution. I mean, if the plan does unfold and all of a sudden these regions get thousands of doses of a vaccine, how are these healthcare units going to, in fact, gather the people and inject them so that we are ultimately protected? Have you been working with the health units at all, or lobbying them to identify and publish their plans in any way?
We've been more focused, like from the province, we've been more focused at the provincial level, trying to get them just to speed up the vaccination rollout. I mean, we've had, either tens of thousands or more than 100,000 doses in freezers and fridges throughout, even while the discussion was that we didn't have supply. We had a lot of supply, it wasn't rolling out. It's starting to roll out more quickly. But yes, I think now that it does sound like yesterday the federal government was confirming that they believe the supply of literally hundreds of thousands of doses are starting to come in next week and will continue. We will actually be pushing for a much clearer, publicly understandable plan about the vaccine rollout. People need some hope, we believe. There's a lot of burnout out there. I don't know if anyone locally in the local health coalitions, have you spoken with your local public health units, Todd?
Yes, I have been in contact several times actually with the MOH here in the Sudbury District Health Unit, Dr. Penny Sutcliffe. And the focus right now is to get enough vaccines up to the Sudbury District area to vaccinate the staff and the residents and the patients in the hospital and the residents in long-term care and in the congregate living situations. And we do have an outbreak at the Sudbury Hospital, the Health Sciences North, and two hallways on the 6th floor are involved. And there are patients and staff. And in fact, I think it was just announced yesterday that 10 staff were sent home. They were tested negative, but they were in contact with COVID. And they're not sure at this point if it's also the B117. So I've been in contact with the health unit, and I know that the vaccines coming north have been limited, and she has not divulged to me what their plan is for the general population when we get to it. But I know that First Nations have received the vaccine and that they've been injected, they've had the vaccine throughout the community, I understand. So
Okay.
on, in the Sudbury.
I'm just wondering if maybe Marie can follow up with regards
Sorry, Elaine.
specifically to Algoma Public Health Unit.
Okay, thanks,
Okay.
Elaine, sorry.
Sorry. Elaine, I'm not really sure, beyond knowing that our long-term care homes have been vaccinated. I don't know that they've got the second dose yet, but I believe they have been vaccinated. I don't know anything about vaccines for the general public, though.
Is that something, though, that you're going to follow up on to determine how our public health unit is going to distribute thousands of vaccines when they actually get here to this region, you know, at any given time? Will they be doing them in community centers? Will they be doing them at hospitals? Will they have to engage in nursing students to help administer the vaccines?
You know, I think those are all good ideas. And I think that hopefully our public health units are using this kind of downtime right now where there was a lack of vaccines to make those plans. I think hopefully the Ministry of Health has been working on that in conjunction with all the different public health units, because we do need a coordinated plan that can be rolled out right away. There's been too much delay already.
So in short, though, we will follow up. Yeah, we can follow up locally and see what is actually being planned, and if people could start to inform the communities.
Thank you.
Yeah. PJ, did you get everything you needed from the North Bay Nugget? I think he was okay. Okay. So Mike from CKDR in Dryden.
Thanks, Natalie. You made it definitely clear, and obviously that's you want people to avoid travel. With Northwest Ontario expected to open up possibly on Tuesday, are you in favor of the stay-at-home order being lifted, or should we remain in lockdown?
I think someone from the Northwest. Jules, you want to answer? Sorry, you got.
Sorry,
Okay.
you know, like, am I muted? No, okay. You know, like, I guess the idea is to nobody likes the lockdown, right? I mean, I don't like the lockdown, but again, if that's what it's going to take to keep the Northwest Ontario safe, then I guess that's what's going to have to happen. But again, it's up to individuals. It's up to the people themselves to make sure that they protect themselves and they protect the community. So you know, like, I mean, if it's going to open up and people are still cautious and wear their masks, wash their hands, keep the distance, then I think it will be fine. But again, it's up to the people to monitor themselves to make sure that the spread of the COVID doesn't happen. So I mean, I certainly hope that the lockdown can be lifted. It's going to make it a little bit easier for everybody to survive, but we'll have to see what happens at this point.
I think the other piece of this is that, you know, we would have hoped that given the situation and given what's happened across Europe with the UK variant, that any opening of the economy and of schools and so on, I realize in the North, it's a different situation, but opening of more businesses and more contacts between people would have been associated with clear direction from the province about stronger public health measures, like what kind of masks, you know, whether people should wear face shields, you know, those sorts of things. Other countries have actually grappled with that. In some countries, people are not getting onto public transit without N95 masks. For example, in you know, other countries, they've had to resort to hard lockdown, the most reduction, for example, in Denmark, in contacts between people that they've had in the entire pandemic to try and actually stem the tide of the UK variant. We were shocked to have the province announce the reopening without any new, clear, stronger public health measures to protect people. And in a circumstance in which the long-term care homes clearly don't have adequate protection and it's not enforced as it is, I mean, people are in danger. And so we wanted to do our part to try and like bring the strongest message that we could about travel, but also when you're going out now, you know, don't wear the cheapest, you know, thinnest, most useless mask, you know, go up at least one to, you know, the 3-ply, good, heavy duty, well-fitting masks. Some people are wearing face shields now, as well as masks out in public when they're grocery shopping. Absolutely hand washing, absolutely keep your distance. All of those things are more important now than ever. And critically for the North, where so many cases have been associated with either international travel or travel into and out of the regions. If people are careful about that, there could be a possibility really of the North at least, and maybe some other areas in Ontario, ducking the potential third wave, which may be what's starting up with the UK variant now in other regions.
Okay, thank you very much, Natalie and Jules. I appreciate it.
Okay, sorry. And Sam from CBC Sudbury? Are you still here, Sam? Just looking.
Can you hear me now?
Oh yeah, there you are.
Perfect. Sorry. Good afternoon. Thank you. So you've actually kind of addressed a little bit about what I was going to ask. I guess, like, what specific measures are you recommending the province take? You've really talked about travel, but I mean, I would like to know a little bit more about what the province should do, in your view, to curb the spread of the variants specifically.
Well, I think provincially, we need a strong, clear message from leadership about interregional travel. Like, stop it right now would be critical, because particularly because the COVID numbers, the current iteration of COVID numbers are still quite high. We're over 1,000 cases per day. The case numbers in long-term care are still very high. I mean, they've come down from the high of January the 14th, as you know, but we're back to, the beginning of December kind of numbers, which at that time were shocking and the worst we'd ever seen. So just because we've kind of gotten used to high numbers does not mean that we're out of the woods. And the ICU numbers have started to go up again. So that's very worrisome. So one, a clear message about not traveling across the province. If there is to be a March break, and we haven't had a chance to meet and discuss that as a coalition, but definitely there would need to be a very clear message about stopping interregional travel in the March break. Absolutely. With the opening of businesses and so on, strong measures to reduce the numbers of people inside at any one time, strong enforced measures around infection control and cleaning. Those businesses that do not follow them need to have fines. They need to face like meaningful consequences for not doing it. The workplaces where we're seeing terrible outbreaks and poor practices, and in long-term care as well, we're still calling for, almost a year after the start of the pandemic, actual enforced IPAC, infection control measures in those homes, meaningful fines, revocation of licenses for terrible players, for the homes that have demonstrated an egregious lack of respect for human life and terrible negligence. And of course, staffing. These measures are critical to save people's lives, getting the care levels up so that people are hydrated and fed so that they can follow infection control practices. These are critical. So in long-term care, there's a set of measures like that every advocate in the province, every group has been calling for now for months and months and months, that still have not happened. In the general community, we need some clear direction around travel. We need some clearer direction around masking, different countries are taking different approaches, but whether improved masking and other types of masking, what the evidence is and what is needed in order to try and reduce the spread of more contagious variants. And particularly in crowded areas like public transit, in the areas of the province that have public transit and so on. In the areas of the province where there have been very low community rates, the issue also is travel, but travel of a different sort, in which people are moving around between regions and coming into and out of the regions. We are going to be talking with our Eastern Ontario health coalitions, which also have very low case numbers in that region, talking about what measures they have consensus around recommending, and in other parts of the province as well. But right now, the North is one area where we think there's a very high risk in the near North and the North because of spring travel, March break travel. Even if there isn't a formal March break, if people tend to take their vacations around that time, there's a higher risk of thousands of people on the road and flying into and out of their communities.
Thank you.
And sorry, my title for in the chat is I'm the Executive Director of the Provincial Health Coalition, so of the Ontario Health Coalition. I think you got everyone else's. If you need them, we can send them to you. Are there any other questions? Okay, thank you. I just, one of the things we had, because this sort of debate about the Northern Bubble kind of came as a surprise, and Dot was responding in Sudbury, and we felt that we needed to have consensus among the Northern Health Coalitions about what our approach was. There really wasn't consensus on whether or not to embrace some of the measures of a Northern Bubble. And so we don't really have a complete answer on that, but we're not either experts in, the provincial supply chain and, distribution of goods and how that could happen and all of those things. It was beyond really our purview to be able to answer that. So I just want to be very honest. What we felt we could do, we should do immediately, which was give the most public education we could about what the risks are. And we have tracked, the pandemic in every way since the very beginning, since early March, and bring people the best public education, the best warning, and the best recommendations we could on an individual level, and a push for government to come out with clearer measures. So I hope we've accomplished that today, and thank you for coming.